helping people to get the resources they need. That's what I do. My name is Lewis, and I'm a social worker here at CART, dedicated to making a difference. So our days are really quite busy. I never feel as though the day is dragging because we're a very active clinic, and for the social work team, our days are really structured around patients' medical appointments here. Typically, patients will come in, they'll see their medical provider, and then they'll see the nurse, and then they'll see the social worker. The social worker meets with the patient twice a year to complete the comprehensive psychosocial assessment, and each of us on the social work team has a caseload of patients that we're assigned to. The comprehensive assessment is aptly named because it really is quite in-depth. We assess a variety of psychosocial areas of need. We complete a number of formal mental health screenings, including screening for anxiety, depression, trauma, and we make referrals as appropriate and as needed. So if patients need referrals for therapy, counseling, psychiatry services, support groups, grief support, we're fortunate to have a growing number of services both in-house at CART and externally in the community that we can link patients to when they need it. But aside from the mental health component, we're checking in on several other areas: transportation, housing, food access, substance use. If a patient needs inpatient or outpatient services, we can link them to various resources. Insurance comes up a lot. We're lucky to work with an associate care manager here, Julia, who works very hard to ensure that patients are having their needs met with regard to insurance issues or transportation. And the assessments are really the bread and butter of our work because they inform what referrals we make, when we follow up, how we follow up. But in addition, we're spending a lot of our time on the phone with patients or with community-based organizations, conferring with the other providers here to coordinate patient care, and it keeps us busy. So it really is a wide range of services, and I think that speaks to the uniquely broad array of roles that social workers fill. So we make sure that we're staying connected with our clients and offering them the support they need by, for one, as I said, we typically meet with patients twice a year for the psychosocial assessment. That's when we're doing that really thorough and comprehensive deep dive into their psychosocial needs. But in between, we are frequently speaking with our patients more often, whether they're here at CART for various events or engagement activities, because we do have a growing number of activities and an increasing sense of community here at CART, which is wonderful to see. So sometimes patients may be here for those events and we may see them, they may have questions for us or just want to say hi. Patients also, can frequently call us when they have things going on or questions for us, things they need to address. And in addition, because we are such a teamwork-oriented clinic, we're frequently in communication, really constantly in communication with the medical providers, the nurses, the other care teams here to ensure that if a patient has a social work related need, we're on top of it. We're gonna reach out promptly and offer support. And likewise, when patients mention medical concerns to us, we're always certain to keep those medical providers in the loop so that they can follow up and address the issue. And not just internally, but because many of our patients work with community-based organizations outside of CART, we have really strong relationships with those agencies as well. So we're frequently speaking with their case managers to help coordinate care and make sure that our patients' needs are being addressed holistically. There are so many memorable moments from our work as social workers here. I think the reason is because our work is so fulfilling. We are based in the value of human relationships and the promotion of social justice. And what's most fulfilling is when I'm working with a patient and we make a strong connection, we have a good rapport, and they can see that I'm really here to support them. I'm here to partner with them because it is a collaboration and it's a collaborative effort to promote their self-efficacy, reduce barriers to care, and help them to realize their full potential. So the most rewarding part of that work for me is when a patient can recognize their own progress and achievements, and they can see their power and embrace that. And it's exciting to see a patient realize that in real time, because that is empowerment, and that's what is at the core of social work ethics and values. It's what we learn in social work school and what we do every day in the field. So that's what keeps me inspired to continue coming to work every day and to give the absolute best to my patients.